Hello and welcome to Mission in Focus. This two-part webinar explores the importance of formation. In part one, our conversations with leaders will focus on how formation is essential to continuing our mission, the impact of formation on both individuals and organisations, and how formation has a direct impact on the care we provide. Kerry, you've consulted to a number of Catholic providers about formation. What do you see as the benefit of investing in formation?
Well, I guess if we start with the idea that formation enables an individual to understand the community and engage with that community, and in this case it's the community of a Catholic ministry, then I'd say that there are benefits both for the Catholic ministry itself but also for the individual. So if we think about benefits for the organisation, so if whatever the Catholic ministry, health, aged care or community services, it's an opportunity to align the values and culture with the teachings and traditions of the Catholic Church. I think it's also an opportunity to ensure that the mission is well taken care of, because in formation the focus is actually on understanding Catholic identity and the place of mission and values and therefore of culture across the organisation. From an individual perspective, I think there's a real value for individuals in understanding the sort of story behind a Catholic ministry, and to that end being able to engage with that story. I sometimes think that when we meet with family or whatever, we tell stories around, Uncle Joe or Auntie Flo, and those stories actually help to build a sense of the values of a family, the culture of a family. I think formation can do the same sort of thing for an individual. It can give you those sort of key messages about what matters in this organisation from those particular stories. Now, formation, from our perspective, is really about telling the heritage stories of, first of all, the stories of the gospel of Jesus, the compassionate healer, the compassionate carer. But then there are the stories of particular congregational founders or foundresses who may very well provide a lens through which that Catholic identity is understood. All of that comes out in formation, benefits to the organisation, but I think big benefits to the individuals in the organisation as well.
So Kerry, what are some of the successful models that you've seen of formation programs in organisations?
I think we can think about formation in a whole lot of different ways, but I would say for every Catholic ministry that I think has a successful formation program going, the program is integrated. So whether the leadership is at governance level, so trustees and board, whether it's at the operational level, the senior leadership or the middle managers or the frontline leaders, or in fact the staff providing care, I think there needs to be an integration of the formation process. So that I guess that would be the first thing that I would say. Formation for senior leaders, I think, is absolutely critical. And so the really good programs focus a lot of energy and therefore resources around formation for their senior leaders. To that end, where the model has worked really well would be where those programs have been individualised. And, I recognise that for operational executives coming into a Catholic ministry with great expertise in their own area, formation can be a bit scary. So developing a relationship between the director of mission or the key mission leader and that executive to work out what that person's understanding is of formation, what their previous experiences might be, either of a Catholic ministry or in their workplace, and then being able to build a program that might meet their particular need. In terms of what that program might look like, there could be a range of things. I think we could look at some formal adult education, which is, the process of of introducing new material, and maybe following that new material up with some sort of reflective opportunity with the mission leader. The program might be external, it might be internal. I think we could look at things like opportunities within existing meetings for formation, so reflection for action sort of meetings that actually provide a formative moment within a meeting, a senior leadership meeting or an executive meeting. And likewise at the board level, I think some sort of formation at the beginning of board meetings that may be followed by a once a year activity that actually brings a group together can be a really useful model as well. I know there's a place for pilgrimages, for formation opportunities of working within a ministry, in the coalface, for example. For me, the core part of formation for senior people in particular, but really I guess generally, is that not only do they have the experience, whether it's formal material, whether it's an informal opportunity, whether it's meeting, whatever, but they actually have the chance to reflect on that experience. That's the formative element from my perspective. The other thing I think for a lot of people in an organisation around that I think is really beneficial is around formation in the moment. It's that opportunity, that informal opportunity where somebody actually stops and says, what do you think about that? Or how does that reflect our mission? Or how does that tie in with our values? Or will that actually make it a difference to the sort of care that we can provide to our residents, our patients, whatever? So for me, the really good models do both the formal formation but also that informal formation in the moment.
Kerry, what is the impact you would expect to see from formation efforts?
If we start with the organisation, with the view of the organisation, because they're obviously the ones doing the formation, one of the key impacts is that there is a much greater capacity on the part of the leadership to openly express their understanding of the Catholic identity of that organisation, and to link that with the values and therefore the culture of their organisation. So there's that sort of sense of alignment with the identity, with the mission and with the values and culture right throughout the organisation. Formation is one of the ways in which the trustees or the members can ensure that their canonical requirements around mission are actually being met. So the impact of a solid formation program, one that's really having a positive effect, is that the trustees can then be quite confident that the mission and identity of the organisation is in good hands, is actually being well looked after. From a personal perspective, I think certainly the experience that I've had is leaders saying that they choose specifically to work in a Catholic ministry because it aligns with their personal value set. Some people have even spoken about things like, I sort of feel like I'm at home in this organisation. And formation, I think, embeds that sort of sense of values alignment between the personal values and the organisational values even more strongly. The other thing, of course, for individuals is that they get an opportunity to understand a different way of thinking about their area of technological expertise when they sort of look at it through a Catholic lens. Now, when I say that, I guess what I mean here is that, say for example with nursing, you can be a very compassionate person in nursing if as a leader of nurses you actually develop through your formation experiences an understanding of where that compassion comes from and why it is so fundamental to the practice of nursing in a particular hospital, then you can actually pass that on to your nurses. It doesn't just come from, well, this is what we think. It comes from, it actually fits really well with our, in a sense, view of the world. So, and formation provides that opportunity.
So you would expect to see an impact in the care of our patients and our residents.
Absolutely. Yeah. If the carers are imbued with a sense of values that comes from their engagement with their leaders and perhaps some formation of their own, then it's really having a very significant impact on the way in which care is provided.
Kerry, what are some of the challenges about formation, and how could some of these challenges be overcome?
I think that there's a real challenge when an organisation doesn't prioritise formation. When they say we don't have funds for formation, because obviously really effective formation is going to cost. So I think that's one of the challenges, that lack of priority given by, either the board or by the senior leadership. I actually think that challenge comes about in part because the trustees or the members haven't actually clarified their expectations about what they think is required in the way of formation. At the end of the day, my understanding of many of the Catholic ministries is that the requirement for formation really comes from the trustees or the members, or in the case of the Catholic cares, from the diocesan bishop, that they actually need to say, this is what I expect in the way of formation. If that sort of statement isn't clear enough, then it does give a fair degree of wriggle room, and it can lead to an organisation prioritising something else over formation. I guess the other challenge that I think arises is that sense of busyness, particularly amongst corporate leaders who don't see the value of formation in the same way perhaps as the mission people would see, and therefore they don't prioritise it individually. And I guess finally, I think there is a bit of a challenge in that not every system has the capacity internally to develop its own formation programs. For me, that's another, particularly the smaller systems, they don't actually have that opportunity to develop formation internally. And sometimes the cost of external formation can be a bit prohibitive for the smaller systems. So what would be the solutions? I think the trustees, the members need to be very clear on their expectations about what they expect of formation for senior leaders in particular at governance level, so for board members, but also for senior operational leaders. And then from that, hopefully that will be passed on throughout the system. Mission leaders, particularly the senior mission leaders, need to have really good relationships with their colleagues who are in their executive, so that there's a sense of engagement in that relationship that actually enables that individual focus on formation that I spoke of earlier to be highly regarded, so that formation is actually seen as an opportunity for good news, not for taking away from my busy day. I'm already really busy. And I guess the last thing that I'd think about is that collectively the Catholic ministries need to address how both small and large Catholic ministries can access formation in a way that's equitable for all, regardless of the fact that some are really small and unable to pay. I think there's got to be some collaborative engagement in formation activities, and that might be by way of invitation from the larger systems to smaller systems to take part in some of the formation, or by having collaborative endeavours. I know that some of the big systems actually invite their education and their health and aged care and their social services people to come together for formation. So I think that there are lots of really good things happening. I see that as being one of the ways of overcoming the challenges to producing really good and effective formation.
I think it's helping people to get exposed to the way we think around here when it comes to mission. And what I mean by get exposed is I mean that the penny drops, and when they're sitting at a meeting, if they've had enough formation in themselves, suddenly their brain starts to make the connections and thinking, oh well, we're doing work over here for this group, but actually there's a vulnerable group over there, or this is happening in our system here with women and disadvantage and maybe Indigenous health. What are we doing? And I think sometimes it happens just naturally, because of people's own personalities. But with formation, I think it happens much more intentionally because it's in their minds, their bodies, their hearts, and suddenly they make the connections and then say, this is what we need to do. And if you're not having enough people who are formed, then you can't have that capacity building.
And where do you focus your formation efforts at Mercy?
I would say we have 3 key areas. One is with the board, 2 with the executive, and then the 3rd are this big cluster, we call them the leadership group, or I'd call them, and they're probably about 200 or 300 in that level. So that's how I cluster them, because it helps me think through what do different groups need according, if I'm a board member, an executive, or this leadership group, which is big and diverse and spread across the country. So Margaret, in those 3 clusters, that's how I see we need to be effective in formation.
Joy, you mentioned those 3 groups, the board, the executive and the leadership group. How does formation look for those 3 groups?
Yeah, for the board, it looks like, you know, in the public view of the organisation, in one way you could say you can't see it happening because it all happens behind closed doors. But what would you see? You'd definitely see, and we've developed this more in the last couple of years, a focused curriculum based on the Formation for Mission resource, and they prioritise what they think their learnings are in a year. We've got about a 2-year cycle, and so then we get at certain events we would get certain speakers on particular topics based on that curriculum to speak to the board members and have some engagement with that. The executive are a bit the same. Again, the curriculum's developed based on their feedback using the tool, and then we roll out a program for the year, or we've done it nearly over a 2-year period. What I find is helpful for those people at that level is that they're driving what they can see their needs, and that's why the tool or the resource was helpful to get a structure, because there's a lot of stuff you can do around formation, but what is it that you need to happen? What is it that a board member and an executive member needs in a healthcare organisation that calls itself Catholic? And that's why it's helped refine even their minds around what's helpful to look at. So that's those 2 groups. And then the 3rd group is that, like I said, broad leadership group. Now, who's that made up of? It's made up of sometimes people at a management level, which could be a nursing unit manager. It could be the manager of our aged care maintenance group. It could be our catering managers, say, of aged care. There's sort of all those senior people in some leadership role. The other group it also takes into account is the chairs of our ethos, values and culture committees, because they do work at the local sites, because we're nearly spread across 45 sites. So how do you drive mission locally or lead it when I've got a role here, but across a system? So it's sort of like this 3rd area is kind of like, again, dropping seeds that spread out. But what do we do in terms of specific curriculum? They're a bit different because we rely on the Mercy Ethos formation team to help us do formation with those groups. So for certain leaders, that would mean within 3 or 6 months of them starting at Mercy, they would do a 2-day leadership program. And then there's various other programs that they customise to meet our needs.
Julia, what are you trying to achieve with your formation efforts?
There's a few things, but one of the key things is helping, especially the board and executive, be clear on how they articulate why formation matters. Because if they're clear on why it matters, then they model that for others. And when they say to their staff, especially the executives, and remember we're part of a big system, you say to them, this is important and this is why it matters. So you set the expectation that this is just what we do around here. And it becomes easier to get people to engage in formation when the leaders are clear on why it makes a difference and what it does to an organisation, and that it's part of the culture.
Our conversations about the importance of formation continue in part 2 of this webinar. You'll find the link on the Catholic Health Australia website. You'll meet 3 more leaders to gain their perspectives on formation and their insights into facilitating a formation program. So please join us. I'm Margaret Deeren. Thanks for being part of the conversation.